At some point this fall, Senator, you're going to likely have to cast a vote on a health care plan. You're either for it or against it. And you know there's going to be a large group of people, if you haven't figured this out already, who are not going to support that final vote. They're either going to be a vocal minority or a vocal majority. You're going to be hearing from them. How is knowing that you're going to have some pretty deep division on a final vote kind of factoring into your decision?
Well, I certainly know I'm held accountable. I mean, this is a big issue, and as I said, it makes tremendous ramifications in a lot of different places, whether it's our economy and getting our economy back on track, or whether it's making sure that we've got the kind of health care that we need and deserve in this country, making good use of systems that we have. I mean, you know, that's an important thing, too. I think people need to know that. We've got 500,000 Arkansans that are uninsured, Roby, and 66,000 of them are children. But of those 66,000 children, 2/3 of them are eligible for our kids. It's a great program. It's a partnership between the state and the federal government. We also need to make sure that we're empowering Americans to know what exists now instead of recreating the wheel. But you're right, I will be held accountable, there's no doubt. And I'm going to work hard to make whatever plan that comes to the vote the best plan that it could be to ensure that we do all of those things. And ultimately, I will make a decision like I always do in what I think is best for Arkansans, all Arkansans.
All right, on recess this week, a couple of Republican senators, namely Charles Grassley of Iowa, who is on the Senate Finance Committee with you, he seemed to fall off the bipartisan wagon on health care. What kind of message do you think it will send if there is a straight line party vote on health care reform? Because it seems to be trending in that direction.
Well, I don't know that Chuck Grassley has fallen off the wagon, quite frankly. I think that they're still having some talks and negotiations. I think his party leadership's putting some pretty tough chains on him in terms of trying to work hard to come up with a bipartisan plan. And I think that's just so disappointing. I mean, the whole purpose here is to do something that's good for America. And I haven't heard a lot of alternatives coming out of the Republican leadership in terms of what they're going to do or what they think we should do or a plan that they think should happen. You know, I don't believe that we can just walk away from this and say no. I think we have to work hard in a bipartisan way to come up with the best possible plan we can. And I know that I've worked very hard with Olympia Snowe for the last 6 or 7 years on a great plan that is going to be, a lot of which is going to be encompassed, hopefully, in our Finance Committee package, based on looking at those 46 million Americans that are uninsured and realizing that about 25 million of them are small businesses and self-employed people. And what Olympia and I did was to produce a bill that would actually make available to small businesses and self-employed people the same opportunity that I have as a federal employee to be able to pool themselves. I pool myself with all 8-10 million of the other federal employees, and I get a pretty good deal. The government is able to, when they pool all those federal employees, really negotiate with the private insurance industry. I mean, I have private insurance, but it's negotiated out of that collective pool of federal employees, and therefore I get more meaningful coverage at a lower cost. Olympia and I put together a package that does that for small businesses and self-employed people. It allows them to pool themselves across the country, state by state at first, and then over a couple of years they can buy into a federal pool, and that way they can manage their risk and their benefits all together and get a better options and better opportunities, better choices at a more reasonable cost.
Let's just put everybody in your plan. That seems to be the solution right there.
Well, and the great thing about our plan and the reason that we jumped on it was because you're exactly right. I mean, if you can cover 25 of those 46 million by creating a plan like that, and then you can capture another larger group of people who are already eligible for good plans, meaningful plans out there like our kids, where you've got children of working families that could access health care there. That's always been my objective, and that is, instead of just completely reinventing the wheel, let's make sure that we create programs that get a good number of the uninsured that have good based on a program that's got good track record, which the federal employees do. I mean, for 40 years now, federal employees have been getting a pretty good deal here. And, you know, to see those programs work and then making sure that those who are eligible for programs that already exist, that we know how to manage, but we can obviously do a better job in terms of their efficiency of their delivery, and then start working on the most difficult of those who are not covered. If anybody thinks that Washington is going to take a pill and the next day health care reform is going to happen and everything's going to be okay, it's not going to work that way. I mean, this is a 10-year bill, so all of the things that we're talking about doing, the insurance reforms hopefully will come early in the package, but it's going to all happen over a series of 10 years in order to be able to make sure that it works and to be able to make sure that we can pay for it.
Do you see any way that you do not vote for what becomes the Democratic leadership's proposal in the Senate?
Well, if it doesn't meet the objectives I have for Arkansans and it's not going to be good for Arkansas, I'm not voting on it because of who else is voting on it. I'm going to vote for it because it'll be good for Arkansans.
All right, let's turn our attention to some polling numbers. Our Talk Business Quarterly poll came out this past week. Shows you with a job performance rating of 49% approval, 40% disapprove. Are you worried about your political standing with Arkansas voters?
You know, Roby, first of all, it's an honor and a privilege I have to serve the people of Arkansas and Washington, and I never take it for granted. But I also know that this is a difficult time. The economy's tough, people are anxious about things, and they continue to be anxious about everything from the economy to health care to education. You know, I know myself. You know, Steve and I've worked hard to try to save for the boys' college education, and we saw it cut in half. You know, and with that, we saw cut in half our retirement that we've worked hard to put aside. So I know people are anxious out there, and I know that they're frightened about, you know, what's coming next. How is this going to happen? So I understand that, but I think by and large people understand that I'm going to work hard to do what's right for Arkansas, and that as a mother and as a daughter, as a wife, and certainly as a senator, but more importantly as those others, that I understand a lot of what they're going through, and I'm anxious too.
All right, Senator Blanche Lincoln, thank you so much for your time. We really appreciate you.
Thanks, Roby. Great to be with you.
We're back with more right after this.